It is a very exciting session today because um, it's our last session of the year. So before I start, I'll just briefly introduce myself. I'm Lamona Chanda. I'm the CEO and the co-founder of the Global Activist Network. We amplify and we celebrate changemakers' voices from all over the world. So welcome, everyone. You all are doing amazing work, and we really have amazing speakers tonight. Today, as I said, that we celebrate our last session of the year. We launched this year, and we wanted to invite three really amazing change makers who have joined us from different parts of the world. But before we delve into our session, I would like to invite our co-founder and executive director, Gertrude Asumadu, to say a few words on our journey and our vision for next year so that you get a flavor of what we're thinking of doing next year. So, Gertrude.
Hi, good evening, everyone, and thank you so much for joining us. Just like Lamona said, today is our very last session, and we felt it right to invite three of the change makers that we spotlighted throughout the year. And thank you so much to the amazing and fantastic change makers who have joined us and right on time. And yeah, looking forward to this session and also to the coming years for all the programs and sessions that we have in store. So please stay connected with us. And yeah, we are happy to have you here this evening. And yeah, over to you, Lemona.
Thank you. So, as Gertrude sort of hinted, we have really exciting stuff coming up next year. So, please stay connected with us through our social media channels and our website. And without further delay, I'll now briefly introduce these change makers. I would like to introduce our first change maker, Molly Fenton. All three of our change makers have a lot of achievements under their belt, but I'll just briefly highlight some of the achievements. Molly Fenton is a multi-award winning young women's health activist. She's a TEDx speaker and the founder of Love Your Period campaign, which she started after a brain tumor diagnosis that was triggered by hormonal difficulties and difficult changes through her puberty and periods. Molly holds a British Citizen Award for services to healthcare and volunteers for charities and organizations across Wales and the wider UK to create change for all, but specifically for young women whose outside lives get neglected when they become sick, such as CAVU-HB Youth Advisory Board, that the Every Women Festival, and the Brain Tumor Charity. She also sits on roundtables with both Welsh Government and Westminster's Department of Education for period dignity in education. Molly documents her life and challenges as a disabled young woman facing serious illness online to dismantle stigmas and misconceptions for embarrassing topics that are usually avoided. So welcome, Molly. Moving on to our second change maker, Dauda Mane. Dauda is a young, dynamic youth leader and enthusiastic climate change advocate. He's passionate about sustainable development goals, perfect for what we do. He has been named as Common Purpose 25 Under 25 Global Legacy Award winner in 2024 for his commitment and outstanding contribution to his community, and has been recognized as a change maker by the Global Activist New York Network. He is a Yali RCL and Ubuntu United Nations alumni. Dauda is also the founder of two impactful organizations, and I'm sure that I'm killing the pronunciation of these. Please pardon me. Nyancho Orphan Foundation in Gambia and Young African Climate Activist. At the moment, he's attending the Pan-African Youth Ambassador for Internet Governance. So welcome, Dauda. Moving on to our third changemaker, Oluwatomi Omopetu. Oluwatomi is a public health physician and hospital consultant at the University College Hospital, Ibadan, Nigeria. And she has an extensive list of certifications and qualifications from various world-renowned institutions, including Johns Hopkins. She serves on the board of 2 NGOs in Nigeria and leads an NGO called Child Health Initiative that focuses on improving health outcomes for women and adolescent girls in sub-Saharan Africa. She was a global shaper and co-curator with the Ibadan Hub for the World Economic Forum, a National Institutes of Health NCI Summer Cancer Prevention Fellow, a President Obama's yearly Regional Leadership Fellow, an African Changemaker 2018 Fellow, and a Hive Global Leader. She hosts a podcast in conversations with Funpay. She's also a founding member of Cord Africa, where collaborates with public health experts and global health leaders in addressing public health issues and research on the African continent. So as you can see, the 3 of our change makers have a wide range of experiences, focus areas, and they come from very different places in the world. So I would like to welcome all of you today. And without any further delay, I'll just start with the questions that we're dying to ask you. I will start with Molly. Can you tell us what inspired you to start your organization or your initiative?
Hi, everyone. Can you hear me okay? Before I start speaking, are we good?
Yeah, we can hear
Okay.
you fine.
Excellent. So what inspired me, there's probably multiple things that inspired me. As you previously mentioned, my brain tumor diagnosis was something that made a lot of things make sense to me. I had a very difficult puberty that triggered a lot of bullying when I was in primary school. And I just really, really struggled to feel like I knew my body and I had some control, and my body and my mind were in sync, and that it was my body. And I didn't feel that any young person, especially, should feel that they have to battle that. So that was a big inspiration in going, instead of let's just target brain tumors or target anything specifically, let's have a look at something that is, the norm is the best way to put it for lots of people. And therefore, we could really look at understanding the basics and feeling more well in our bodies to ensure that that could happen. So definitely, and it's an inspiring factor was making this an inclusive space for people that do have periods, whether they're going to become unwell or not. It's about knowing the signs and health-wise. Another thing for me was that we didn't have and still don't have open conversations about these things in my family. The campaign has changed that a lot, but these topics weren't things that I felt comfortable going to talk to my mum to. And my younger sister, when she started her period, she came to me and I turned her away and I said, "Oh, that's disgusting." And she said to me, "I wish, you were the person I trusted." So it was about ensuring that everyone could have that big sister figure, even if they don't exist in their lives, as a safe space for them, again, whether they become ill or not.
Thank you so much, Molly. And rightfully, you identified this is a stigmatized topic, I think pretty much in any part of the world that we see. So you're doing incredible work. Thank you for that. Moving on to, I would like to ask the same question to Dauda. Do we have Dauda online?
I think you're on mute, so can you unmute yourself?
So, good evening, everyone. I'm Dauda Mane from the Gambia. Please, can you repeat the question?
Yes. So can you please tell us what inspired you to start your organization or your initiative?
Thank you so much. So, back in 2002, I can say, when I when I lost my dad. By then I was very young. You know, I had a lot of difficulties, especially when it is come to education. We all know that we are in society whereby when you came from a very poor background and at the same time you lost one or two of your parents, it is always difficult for you, especially when you want to go to school or you have a aim for education. So this has really create a very negative impact in my journey as a student, as someone who wants to learn up to a level that I will say, okay, I want to do a PhD, for example. So going through all these difficulties, it has really delayed my education, and it has I can so many been so difficult for because I don't have someone to be there, to prevent me like father sometimes motivate child or his daughter, you know, so when it's so it's really it's a very negative impact in my career, I can say. So growing up in society, same people going through difficulties and they are orphans. I know I have been through that. So I say, okay, if there are no one to stand for these kids or these orphans, probably they are gonna face the same difficulties I went through. So I say, no, then as far as I have already experienced this journey, I don't want these children or these orphans to go through the challenges or journey that I face. Maybe they have bigger dreams. So there must be someone beside them or to support them so that they achieve their dreams. So from there, I start this organization, Nyanjo Foundation, to support these orphans to get access to education and basic life or needs that any orphan, any children with parents would have. So that's what inspired me to start this organization. Thank you.
Thank you so much, Dauda, for sharing your journey. Once again, this is a very important area of work that you're focusing on. And unfortunately, that is the reality. Irrespective of how developed the country is, poverty impacts you and your ability to access education and even the quality of education that you can get. So, my respect and support for the work that you do. So moving on, I would like to ask the same question to Oluwatomi. Please share with us what inspired you to start your organization or your initiative or the work that you're doing.
So hello, good afternoon. Can you hear me? Okay. So good afternoon, everyone, and thank you for having me. So my story is a little similar to Molly's story because as a young girl, I had very painful periods, and my mom was a nurse, so it was easy for me to even get the help I required. However, that triggered a thought in my mind that there were so many other girls who were probably going through the same thing, who did not have the support that I had. And then fast forward to many years later, when I would go through my residency training as a doctor, we had postings that were called rural postings, where we went into underserved communities, hard to reach areas, and we spent 1 month, 2 months there. And in looking at those areas and in sitting in those communities for a month where there's barely electricity and potable water and all of that, I kept seeing communities of girls. And I kept asking myself, so if these girls have painful periods, if they have questions to ask a doctor, it is unlikely they would ever have the opportunity to ask any doctor any question, because those kinds of communities would almost never bring any child to the hospital except child is almost dead. And the child must maybe have a serious disease, something that the child is already at the door of death. But I'm sure that girls would love to sit around not necessarily a doctor, a qualified health professional, ask questions that they probably do not want to discuss with their patients, their parents or relatives, get solid answers, correct answers that help them navigate life and make excellent choices regarding their health. And that was what prompted me to start in an informal way in 2016. Started gathering those girls after my postings during the day. In the evening, I'd get them to sit around, we'll gist, and then I ask them to ask questions, any questions. Ask them anonymously, write on a piece of paper, ask me. And so the questions were many, varied, from periods to boys to contraception, to teenage pregnancy, to abuse from older men that they lived with, uncles that were in their homes and all of that. And so I saw that in all the communities I was posted to in that 6-year residency, the stories and the issues were the same. And that prompted me to then make it more structured, develop a curriculum that I could deploy and use for in-school girls and out-of-school girls. And that has been the journey so far. I never knew that we're going to get to the point where I'll be able to reach 4,000 girls over those years. But yes, that is what prompted me, the need for girls to have correct information to make proper choices. Thank you.
Wow, that's a very high number. And once again, access to health, access to healthcare services, and you're touching on so many aspects of it. And it is, as you highlighted, it can be quite complex and it can be very interrelated with other issues. So, you know, really congratulations for doing the work that you do. So I will now move on to, I mean, I will ask each one of you the same question, but I will try to sort of um, change the speaker who initiates the conversation. This time I'm going to go with Dauda and ask, you know, we are only 6 years away from 2030 by when we're supposed to deliver the Agenda 2030 and meet the Sustainable Development Goals. What is your view about attaining them? And so far, the work that you have done, are there any highlights that you would like to share with us?
Sure, thank you so much once again. Yeah, there are many highlights that I want to share with you because so far since we start, I can say we start the initiative back in 2019. By then, there was COVID-19, which has a little delay most of the activity we want. So, but in 2020, into 2020, so we were able to buy a plot of land here in my community where we are constructing an orphanage. And this orphanage, so far, when it is finished, it can take up to 50 orphans and also include classrooms for learning or technical skills and others. So in coming 6 years, we want to expand, not just in my community, but also we want to expand to other communities so that we can achieve our target because we want to impact like 1,000 orphans, different community, only in my community. In my community, it has started in my community, but there are big community that there are numbers of orphans that they are going through the same challenges. So in order to achieve our dream before 2030, this is what we want to do. In each and every community, we want to buy a plot of there. If we have support, we also look for funds, from various institutions. So if we have support, we want to, at least in each and every community, at least 5 communities around my community, we want to have a plot of land, and also start to support orphans there. So far, buying a plot of land in my community, it is very expensive, but so far we were able to get one and start the construction of the. So, thank you.
Dauda, I think your connection, so you can turn off your video. Maybe that would help.
Sorry?
If you can turn off your video, like to help with your, because I think your internet is like interrupting, like it's not that stable.
Yeah.
All right, thank you.
So what I am to say, in order to achieve target 20, is that we want to expand not only in my community, but also to surrounded communities around my community, like to 5 or 6 communities. The same thing that we did in my community, like to buy a plot of land to start orphanage there, and that orphanage will be having classrooms and technical center like all classes. So we have done that in my community, and we still work on it, even though we are yet to complete the construction. This is our aim and this is our target before 2030. But also we need like a lot of support, a lot of sponsor in order to reach our target. So far, the is that we have already started and we have a plot of land and we have already started the construction of the orphanage. Thank you.
Thank you. So I'll move on to Tommy now. If you share your views on, what you think about meeting the Agenda 2030 by 2030, and any highlights that you would like to share about your journey.
Thank you very much. Well, I think that the SDGs as they are goals that are achievable, but that are not achievable in silos. We need the nexus of academia, civil society, governments, and citizens to come together to achieve those goals. I don't feel like there's a particular sector alone or private sector alone that can actually achieve any of those goals in any of the countries. And of course, because of the way countries are set up, it means that developed countries are more likely to move towards those targets, while developing countries battle a lot of social, economic issues that tend to take away their focus from moving towards the SDGs. So I think that it has to be a concerted effort. It needs to be continually in the conversations. Countries, people, those in academia need to realize that we cannot stay in conferences and meetings and writing scientific papers and abstracts regarding the things that are on the goals without interfacing with those who are in public policy, those who are working in the development world, those who are in the private sector, engaging citizens, creating awareness, sensitization regarding where we're going. It's only when everybody can collaborate or when there is an intersection of those collaborations that I feel that we will eventually be able to move towards those goals. And it therefore means that in places where it is unlikely that those goals will be met without additional extra interventions like the things that we're talking about today that we've heard Molly and Dauda talk about, and all the leaders that have been highlighted throughout the year, it then means that those goals may never become achieved if you just leave it to lie like that. Like we just feel like, we're working towards them. But if you look at some of the trackers, you see 162 countries are not on the targets. They are not on the path to achieving many of those targets. So, and I think that sometimes it's not that people or countries or institutions do not want to achieve those targets. It's just that there's so much that we're competing with. My organization deals with SDG 3 and 5. We're focused on health and gender equity because we believe that when you empower girls, you empower women, you empower nations, you empower them to make more responsible choices. An empowered girl will remind her mom that she needs to go for HPV, vaccines and all of that. And whether the parents have money or not, they'll begin to put it together. I've seen it with my girls, and over, eventually, they're able to, get that out of the way. And that helps not just with SDG 5, but also with 3. I've seen girls that use tissue, cut pieces of cloth for their periods every month because their parents cannot afford sanitary pads, period poverty is a real thing here. And maybe sanitary pads cost about 1,500 or 2,000 naira, which will be about $1, $2. But many families in Nigeria, about 70% or more, already are living below the poverty line, meaning that their parents can afford less than $10 a day. So a parent that can afford $10 a day is not going to spend $1 or $2 out of that to buy a sanitary pad for a girl. For a family that has 6 children to feed, it is unlikely to happen. And so you see them use very unsanitary products, just cut their clothes and use it and all of that. But with constant engagement, when we talk about the health issues, the complications, you know, and the reasons why they need to be able to now find things that are locally like acceptable, that are still hygienic. We talk about hygiene and all of that regarding their periods and everything that surrounds that. Many of them come back to tell me that, okay, so my parents said we can do this, you know, we can earmark this, we are able to, and that has also shaped the work that I do. When I started out, it was just to talk to the girls, engage them, you know, and then later we're able to refine our curriculum based on their needs, to tell the girls, tell us the majority of the things they wanted to talk about. So we're able to tone down our curriculum to something that focused on healthy choices, you know, alcohol, tobacco smoking, healthy diets, physical activity, and periods, which we know that every girl wants to talk about. And then we throw in the bonus of, you know, things like around contraception, boys, and all of that. Yes. So we have those conversations. And that has helped many of them to realize that they can make better choices. And we believe that even if it is one girl that we're able to help, you never know who that girl is going to become. You never know how empowered that girl, whether she's going to become a peer mentor, whether she's going to become someone who is able to influence our community. And the goal for us for 2030 is to be able to reach 1 million girls. So currently we're revamping everything. We posting everywhere. We're revamping our style, what we're doing, streamlining the curriculum, our method of delivery. And in some of the places we've had to also step up to actually provide pads. You know, we have like a recycling fund, a revolving fund for pads in some schools. So that means that once the pads, if you're in school, your period starts, you don't have to panic. The girls are the ones that run it. So we have the system where the girls are trained, and then they just have a teacher that has oversight to ensure that there are always pads in school, whether the girls start their periods in school or not, they're able to. And, you know, we piloted it successfully and also some of those things we've been able to, just from the feedback that we get, we've been able to refine them. But we always remind ourselves at our team meetings that we're working towards goals 3 and 5, ensuring that we're able to work towards health for all. Our subset is girls, our focus is girls and women. And then ensuring that, so our focus, that's where the intersection of the SDG 5 comes, gender equity, that we are working towards ensuring that we try to close the gap between what has been done for the males over the years and what we're able to provide for the females in our communities. Thank you. So that's where we're at.
Thank you, Tommy. So now moving on to Molly, would you like to share some of your highlights and also what do you think about meeting Agenda 2030 by 2030?
So literally, I have the exact same mindset of everything that's been said so far. The key bit I'd like to reiterate is this idea of collaboration. And even if it can't be collaboration, we're talking about cooperation. In the United Kingdom, we are very lucky. We have an NHS service. And whilst this is fantastic, the National Health Service means that we get pretty much free healthcare. It's all over the news at the moment for pretty much being broken. It's underfunded. The waiting lists are ridiculous. The amount of people dying unnecessarily is completely out of this world when we assume where the United Kingdom is placed when it comes to the quality of life and well-being on the global scale. So the Love Your Period campaign does touch upon things like medical misogyny that we hear a lot, which we know comes under, you know, health and well-being, but also the gender equality issue, and within reduced inequalities as well, which we know does come up on these points. And we're hearing this all the time, which is why the basics of what the Love Your Period campaign is trying to do, and my general campaigning with other charities, is knowing our bodies and knowing the underlying what is normal for ourselves, because of course that is unique. I think it's achievable if we change yesterday, how we work and how we cooperate with each other and what our mindsets are. There are so many, let's pick up on periods, for example, continuing that conversation. There are so many charities in the UK that are working UK-wide, all pretty much doing the same thing. The lack of collaboration is something that I complain about every single day. I shouldn't complain. I'm trying to act on it, see what we can do, but it's very, very difficult. So it's how do we get out of this mindset of, at the end of the day, this is not about credit and putting logos on things. This is about making the right sort of change for the right reasons. So with the cooperation and collaboration, and with keeping these goals in mind, which I do think slip some people's minds, especially in countries like the United Kingdom, where we assume, or we maybe compare ourselves to other countries and go, oh, well, we don't need to act because things could be worse. The idea is things could be better. And it's a very worrying time going into the winter with the cost of living crisis since the COVID-19 pandemic, where we know that there are families that are in dire need despite living in the United Kingdom, which again is such a high up country for the health and well-being of people, supposedly worldwide. So to sum that up, yes, I think we can do it if we change right now. And young people have to be included in that, most definitely. Some highlights I would definitely say would be getting free period products in schools across Wales. We know that fits into the very first point when it comes to poverty and these goals. These are now being expanded and we're seeing them in community hubs, which are community centres essentially, and people are getting the right sort of support that they need. We are worried about how far that would go. Yesterday, I did 20,000 steps delivering kits to food banks and children's centres, wherever we could get some reusable kits, looking at environmental sustainability goals, where families could be quite literally picked up out of period poverty with the education they need, but also with these products that can last many years. So we've been very lucky to be able to hand sew those and get them out as needed. So that's definitely two excellent goals. And for myself, I think having this conversation expand into Wales has been excellent. When people see the United Kingdom, they see London, and UK-wide charities, when they see the United Kingdom, they see England. Wales is a devolved nation, as with Scotland and Northern Ireland. I live in Wales, and in a lot of my roles, I'm the only Welsh ambassador or Welsh person in the room that ensures that our members of Senedd, so the Senedd is our parliament, are held account and brought into these conversations. Unfortunately, with a lot of health activism, we know that politics does come into it. Politics comes into pretty much everything, unfortunately. So it's about keeping them accountable and ensuring that work is happening in Wales so that it's not a postcode lottery of the point where if you live in Wales, you're less likely to get this treatment, brain tumor wise now, you're less likely to survive. We're not looking at issues like that. And myself, I had to travel across the border onto the other side of England to get to the hospital that I needed to. And that I didn't think was okay, because that is a large strain on the families, despite having the National Health Service and free healthcare. So bringing Wales into the conversation and building those connections with the members of Senedd, despite their party or political views, I'd say has probably been the best achievement, because it means that we're getting more young people quite physically standing inside the Welsh government, having their voices heard by the people that are usually too busy to stop and hear them, because they have to. They're stood right in front of them. So that one makes me really, really happy.
Thank you. And, it's amazing how the three of you have focused on three very different aspects of delivering on the Agenda 2030. Dauda focused on sort of looking at it from a very local perspective. Molly, you highlighted on the politics of it and other areas as well. And Tommy focused on how civil societies can play a role. So it's amazing work that you all three are doing. Molly, I will retain your floor and I will ask you I would like you to be the first speaker now. We sort of focused a little bit on your highlights and what your thoughts on the Sustainable Development Goals. What has been the most challenging aspect for you?
Goodness. Unfortunately, a list of things are coming to mind. There's two angles I'd take this. Number one, my age. I'm 22 now. I was 13 when I began girls' rights activism through my school and local councils and parliaments that they do for young people. But I found them very tokenistic, I'm afraid to say. And having your voice taken seriously as a young person who is believed to have very little knowledge has been a big issue. Comes with that a massive generational divide. In my favorite line to say when I do any sort of talk is, if you don't include us now, then it's going to be people like me in 30 years' time running your conferences, running your webinars, and doing the exact same work that you've done because you didn't include us in the first place. So we're working really, really hard through as many projects as we can, really, to ensure that we're bringing generations together again and rebuilding that communication, as I feel that that's a first step. And then personally, as an activist, I'd say that obviously living with a brain tumor has been quite an adjustment. I'm very lucky to be alive and recognize that. However, my multiple illnesses have meant that my brain works very differently to people around me, and it can be extremely frustrating to fit in as a member of society who maybe sometimes can't get her words out and sometimes can't remember things and really, really struggles on top of that, which then unfortunately does have a toll on being taken seriously. Because of the level of ableism that we do see across the world. And it's not something I think we assume would happen in places like the UK, but we know that things are very unjust at the moment. So trying to be taken seriously, being young, being female, and then having additional challenges on top in rooms where there are some very, very influential change makers who are a lot older and have a lot more money and have a lot more impact than me has been very, very difficult. And I understand why so many youth activists, such as myself and people I'm friends with, have stepped back from the space because it can be a real confidence kick. So I suppose that ties in with the generational thing. If we have better communication, conversation, and understanding, and maybe have a look at this from an empathy point of view as opposed to performative activism, then we're going to be able to cooperate and collaborate better. And it's all just added up in a circle now back to the last question, because that is ultimately what we need to do.
Thank you so much. I would like to add that what counts is genuine social change. And I'm sure irrespective of how many successful change makers you see in the room or anywhere in any platform, your work is driving genuine social change, and that's worth a lot. Maybe more than how we would quantify with money. So keep doing what you're doing. I will move on to Tommy now with the same question. What has been the most challenging aspect of your work?
I think that at some point, when we took a step back to reevaluate what we were doing and reorder what we were doing, the space, well, everybody goes through personal challenges. So I took some personal time off, just to be able to regroup. I felt that, well, it's possible for you to push through some personal issues, but sometimes it's also good for you to retreat and then come back better and healed than pushing through sometimes. I did that, but that meant that by the time I was done, a lot of my team members, we have 16 team members. It meant that by the time I was done, almost everybody had either relocated because of the economic issues in Nigeria and everything, or had moved out of the city where we are based, Ibadan. So as of today, like we still have virtual meetings, but it means that I'm the only person within the city of Ibadan currently. in Nigeria. And that has altered, everything, because we always had a team that was ready to go around, do the field work, do the preparatory work before I came in and all of that. That has changed everything. And so I think that the coming back and scaling up has been the most challenging for me. I've met the girls after I've met some parents, and on that part, on doing the work itself, it gives me joy. I can do it free for the rest of my life. I love girls. I love working with them and all of that. So that has not been a challenge for me at all. So the challenge has been me getting to scale up, me needing, I think, to find a team, an on-ground team again, and setting that up again, and putting that team together and being able to work with them. So I think that for me, because we've been accepted, the ministries have given us the approvals that we need, the schools, the orphanages, in fact, we'll get to some places, we're done with the girls, and then the schools will be like, we wanted to come and talk to the boys. I'm like, no, I don't talk to boys. I talk to girls alone. So regarding the work itself, it's been good. But now scaling up and getting a solid team that is on ground and available, that's my current biggest challenge. And I hope that I'm able to solve that between now and first quarter of 2025. Yeah.
Thank you so much for sharing. And you're absolutely right. Reflection is, I think, one of the best ways to sort of look back at what we're doing and evaluate what we should be doing next. Moving on to Dauda, I'll ask the same questions. What has been the most challenging aspect of your work?
Thank you so much. I can say the beginning of this initiative has been really changing. Because I need to look for people on board so that we have this initiative. There's not one person can start. You need to work with.
Lauda, can you turn off your video? I think we can hear you better when your video is off.
Yes, I just that. So as I was saying, it is a little bit challenging. We start this initiative because we all know that one can stand alone, and when you want to go far, you people. Hello, can you hear me?
Yes, we can.
Sorry, my internet is very bad today. I don't know why.
That's fine. You can, finish what you were saying.
Yeah. So as I was saying, if you want to go far, you don't have to go alone. You have to go with people. So we start this initiative. I invite some people to be part of the board members. Then we start working on the constitution, and then start going to Ministry of Justice here in the Gambia to get this organization registered. But then it is all in 2019. We all know that time it was very difficult worldwide because the COVID-19 was hitting very hard. And sometimes they don't allow you to enter in more than 5 people in the place, and all those face masks should be on, and clean your hands before you enter in certain places. Also, it was difficult to get money to get this foundation register, but I can say 100% of the investment that went to establishment of this foundation came from my pocket, from my small savings, because this is my dream. This is the dream that I have, and I want to make sure that this dream comes true. So I don't have to wait for people to invest. I don't have to wait for people, to sponsor this. The most important thing at that moment is to get this organization registered so that it's legally working in the Gambia. So I had to pull out a lot of money, preparing documents, and then almost half of my savings I have put it all to make sure that we register this organization. Then we have, after registering this organization, and we are thinking about finding a place where we'll have our headquarters and probably have a place to establish an orphanage where these children, where will we stay. And I'm living in a community where, we are just like a 5 or 10 meters from the ocean, So it is a very tourist attractive place in my village, not far from the ocean. And lands here are very expensive. Yeah, lands here are very expensive. You have to be someone rich to get land here. But we are able to get funds from one of my friends from Spain. She told me, Dauda, I see that you wanted to do something great. You want to help orphans in your community to get a better education, to go back to school, this and that. She said, okay, I'm ready to support you. I will look for sponsor. I will look for people to support this initiative because it's something great that you want to start. And I haven't seen someone like you in your community or in your country that coming with such kind of idea. I want to help orphans that, they don't have parents, Then from there, she was able to be able to land here. Then after to start the construction college. Here in the to get funds or to get is very difficult, especially during the COVID time. Even now, it is still very, very difficult funds here in my country. Even though you write a very good proposal, I see that the idea is there. This is going to have a very positive impact in the community, but it's still to get a sponsor that has been always difficult, and it has been always a big challenge for me since I had this initiative. I can't say we had a construction, but still now we are facing this challenge. And I hope that someday can change because government and other institutions see this thing. Just sometimes the government can everything, and sometimes this institution also they cannot do everything. But if you see someone having an idea, a great idea that will impact lives, come on board, support the person, support the initiative. But it is always difficult to get that kind of support here in the Gambia. So that has been one of the challenges I have been facing since I started this initiative. Thank you.
Thank you, Dara. Thank you for highlighting. And yes, collective action. Also, like you mentioned, your friend recognized you. I think recognizing people who drive sort of social change at the grassroots level is very important in meeting the Sustainable Development Goals. So I will now move. I'm just conscious of time. Very quickly, maybe in 1 minute or under, I'll ask the three of you, starting with Tommy. Can you please share some of the amazing collaborations that you have established, and do you recommend collaborations as a tool for accelerating impact?
Absolutely. Thank you. I think that collaborations are the way to go, because you can bring your strengths together. They can cover your weaknesses. You have the opportunity to pull resources together. They might have leverage in some spaces where you do not even have any leverage or opportunities, or the influence to get into those spaces. So I've always believed in the power of collaborations. I've collaborated with many organizations in time past. Started with the Global Shapers in Ibadan. So there is the Global Shapers community of the World Economic Forum. And so that was where we started. We started out with doing outreaches regarding that time. It wasn't as defined as it is now. So we collaborated with them on outreaches that had to do with Lassa fever, which is an hemorrhagic fever that is endemic in Nigeria. We did collaborations with them on malaria, distributing malaria insecticide treated nets to prevent malaria, which is also endemic in Nigeria, to women, pregnant women in markets and all. over time, we also had collaborations with other civil society organizations, like the Smile Builders Initiative in Nigeria, which is an NGO that is focused on non-communicable diseases, which is one of the things, which is one of our own core pillars for the girls. So we worked with them. We had the opportunity to engage different women in clinics, in communities, which also opened us up to many other
So that's
sex
amazing. Sorry to cut
sections.
you off. We're just
Sure, sure. So we've
short on
had
time, but
collaborations.
we want
Yes,
to get
sure.
some idea of some of the, amazing collaborations that you have sort of
Yes, so we've
pursued.
had some.
Moving on to Molly, please share, whether you see this collaboration as a tool, and also like under a minute, any collaboration that you have pursued.
So yes, collaboration is a fantastic tool. If not, cooperation works great. There are many organizations I'm glad that I collaborated with, others I'm not. It's really, really difficult to get the correct balance. Some fantastic ones have been wider international charities such as Plan International and I Rise International for period poverty and girls' rights. But one of my favorite collaborations I have to talk about is I found a fellow young activist. Her name is Amvi, and we managed to get together to kind of create our own sub-campaign, Talk Womanhood, to start these conversations. And actually, that collaboration with a fellow young activist has been more invaluable than any collaboration with a massive international charity. So when we're viewing collaborations, I think don't disregard or don't put at the forefront of your mind the size of the organization and the power that they have, because you have no idea the things that can come out of getting together with like-minded individuals with the same sort of passions, and you add those passions together and you're really, really driving force with that.
Thank you so much. And you rightfully identified another very crucial factor, which is collaborating with the right kind of people with the right mindset. Moving on to Dauda, very quickly, in under a minute, please share with us if you see collaboration as a tool of driving social change, and any collaboration, any meaningful collaboration that you have pursued.
Sure, of course. As as African proverb said, if you want to go fast, go alone. But if you want to go far, go together. So our aim is to go far. So collaboration, of course, it plays a crucial role in supporting the organization you working in, because no one can stand alone. So if you want to go far, you have to collaborate with people. Even the community where you work in, there are people that you need to collaborate with, like village elders, like the village community development leaders. Like when you have any work, when you collaborate with them, whenever you have work, they will come there and and volunteer to work with you. And also not just like to grab people to collaborate with, but also to find right uh someone right that you can collaborate with. So yeah, so it is very important to have collaboration with others. Thank you.
Thank you, Dauda.
And so far
Yes.
so far we haven't collaborated with any institution yet. So we are working on that by 2025, so that we can collaborate with other institutions, so that we can take our organization far. Thank you.
Thank you so much. And I'll ask you the next question very quickly, maybe in under a minute. How has it been to access funding for you? And how can funding be made more accessible to young people such as you who are driving initiatives?
Yeah, as I said previously, it is one of the challenges that we have been facing, and still now we have been facing it. Maybe another parts of the world, it might be easy to get funding, but here in my country, it is always difficult to get funding. Even when you write a very good proposal, at next minute you will find it at the in the dustbin. So it is crazy here to get funding, and it is important to support youths that are trying to drive change, trying to bring a positive impact in the communities. You need to support them. So for this youth to get access to fund, sometimes when someone needs fund, just ask the person to a proposal and see their idea, what impact they are trying to, to bring in the community. Then support them, But sometimes you'll find someone having a good proposal, a good idea, and still now you refuse to support the person. That is crazy, and that's what's happening here in my country. I don't know about other countries, but it is crazy here. Thank you.
Thank you, Dauda. And I will move on to Molly now. If you could share your views on, how have you found it when it came to accessing funding, and how can it be made more accessible?
Yes, so we've only actually ever received funding on one occasion in the last 6 years of Love Your Period, and it was facilitated through an international charity, Plan International, and it was a Young Changemakers program, and it was potentially the best thing I have ever done. It was fantastic because all of the worries that come around finances and money and having an organization and being someone whose brain doesn't work very well for understandable reasons, it meant that the support was there to ensure that we understood how to use funding and what that meant. So I think whether it's more education around what that means and how to apply for these grants and funds, but also the eligibility from them, a lot of campaigns and smaller organizations, at the very beginning, we're 6 years in, we're not looking at making money. We don't take donations of money. We take products and items that we can pass forward for many, many different reasons, which means that we just don't qualify for things. And unfortunately, a lot of these change-making programs are shutting down. They're not running anymore because the funds aren't there. Only 2% of charity funding in the UK goes to charities looking at women and girls issues. So we are massively narrowed because of that as well. And charities are opening up left, right, and centre, which is fantastic. But it means that the cooperation and collaboration is less, and a load of charities are doing the same thing and trying to get money for the same things. So I think better communication, better education, and maybe seeing how we can ensure that young people do have access and aren't up against some of these really, really big organizations for the same sort of funding would be really, really useful.
Absolutely. Absolutely. So moving on to Tommy, if you could share your views on this as well.
Well, thank you. Most of what has happened since 2016 was from me. Regarding the work that we've done with the team so far and all of that. And it was one of the reasons why in the stepping back, I realized that instead of doing it that way, there was a need to have maybe a team or a person whose sole responsibility was to look at the repositories where grants are, look at the opportunities, set up the systems where there are so many systems now where people can give to charities and all of that, online, you can raise funds. There are different ways. And then if it's products, like if it's menstrual products like that, there are also organizations that are willing to give some of those things. And it's just to be able to find them and to be able to, so there needs to be someone who's able to do that research on my team and who is able to curate all those opportunities. And then we're able to position ourselves to apply for it, which means that our papers must be in order, our registration must be in order. We must be aware of what those platforms are. And because many of those platforms would work for countries like Nigeria because we're classified as a lower middle income country. But if we don't take advantage of it, we don't look for it, we don't know that they exist, then it will keep being the big organizations that take advantage of such fundings that are available. So I think that for me, that's one of the highlights now, or the focus areas for 2025, that instead of doing that just personally through savings and all of that, there's a better way to do it, and I should put in the structure. So that structure is currently what is being done currently, and that's also what collaboration does. Listening to everybody talking here, finding out how other people are also able to, because I heard Molly talk about receiving products and giving them, and not just money. So it means for me that it's not just to look for grant providers, but also people that are willing and ready, to ship products that I can distribute to women and girls. And so that has at least expanded my horizon regarding what funding could look like. And I'm ready to go in that direction. Thank you.
Thank you, Tommy. So starting with you again, I will ask you maybe in under 30 seconds to share your proudest moment so far.
meeting one of the girls who was going to drop out of school and who already was had an addiction with cigarettes and all of that in secondary school, high school. Meeting her 2 years after when we had a girl meet up. She just that encounter, she went back home, decided to take some radical steps, had support from her mom, who she linked me up with. We lost touch for about 6 months. And when we now have a girl meet up 2 years after, she had passed her exams, was off tobacco, and she had resumed as an undergraduate in the University of Ibadan, where I graduated from. I cried. I cried a lot because I feel sometimes you feel like you don't see the impact of what you've done. And you've reached 4,000 girls, but where are they? What is happening with them? And all of that. We have orbs where we follow some of them up, but some of them get lost to attrition. That is my proudest moment. I was so happy just seeing her straighten up, and continue with her life. Thank you.
Thank you for sharing. So moving on very quickly to Dauda in under 30 seconds, your proudest moment so far.
My proudest moment I can say when we finally have a land to have a headquarters and orphanage, because something very difficult to have in my community. And when you start something, sometimes there are people who will be there to discourage you, but you just have to believe in yourself and believe in your dreams. Oh, connection.
Thank you. Moving on to Molly.
Sorry, my connection.
Sorry, did I cut you off, Dauda?
Yeah, I think my connection is very, very bad. That's why. I mean, like sometimes when you start an initiative, there will be some people who will be discouraging you, and they would like to discourage you and thinking that that dream wouldn't come true. But you just have to believe in yourself. When we start this, many people we are talking that this is just nonsense. It's not going to work. But until we bought a plot of land here in the community and people start talking, wow, this is real. So this is real. So this was one of my proudest moments in my life since I started this initiative. Thank you.
Thank you. And moving on to Molly now. Very quickly, your proudest moment.
I'd say mine's a bit weird. Mine doesn't sound as impressive, but a lot of the work that I do is linked to other charities, and it's fantastic. They get that recognition. But I was up for an award a few weeks ago, the Welsh Charity Awards, and they were saying the nominees. And when my name was said, everyone in the room was shouting, "Go, Molly!" And I got the award, and I got on stage, and I said, it's not the fact that I'm not happy because you knew who I was. I'm happy because you associate my name with some real change that's happening, and that the word is spreading wide enough for people to recognize my name. That put me to tears before they'd even announced I'd won the award. So that was this is going in the right direction for me, definitely.
Thank you so much, and I'm sure that is the case. So moving on to Dauda, the last question. What is your advice to young people who have ideas, and also any last words that you would like to share about the work that you're planning on doing in the coming few years, or anything that you would like to share?
As to young people or youths like me, is that just believe in yourself, believe in your vision. When why I reached this level or where I am today, it is because I believe in my dream. I can say that I am where I am today. So young people have ideas. Your dreams will be nothing if you didn't apply them. You have to take them out of you, put them there, tell them so that the world can see that you have a dream, and they will see someone who loves your dream, supports your dream, and want to support you so that you can attain your aims. So believe in yourself, no matter what people talk, don't care, don't look at what people saying. You have a dream, and dream, when you apply it, it will create a very positive impact in lives of many people. So go with it. Go with your vision. So that's what I have for young people. Just go. I have been there and I have experienced it. So yeah, thank you.
Thank you, Dauda. Moving on to Molly. Any last words that you have, any exciting work that you're planning on doing in the next few years, and any advice to young people who want to turn their ideas into initiatives?
So I'll start with advice for young people. No amount of change is too small. It doesn't matter whether you're being an activist for something that's just going to happen for 30 people in your class, or if you're running an international campaign. Everything matters, and we have to stop measuring that against each other. And I'm also very blessed to have a really, really cool mindset. It's taken me a long time, but I'm very aware of my mortality and how short life is. And so live every single day like it's your last, and try and work out, is it yourself getting in your own way, or are those barriers actually there? Because sometimes we put barriers up without even realizing we're doing it for ourselves. Some fantastic projects coming up. As I mentioned, I was out yesterday doing all these product deliveries. We're really, really hoping that this can continue. These packs are hand sewn by people from across the UK, actually, and it's bringing together generations, some retired people that are spending their time sewing, but then also teaching young people how to do that as well and be involved. So that's our very, very exciting project. And already we have politicians on board and people getting really, really excited. So we're really hoping to be able to ramp that up in 2025. And I'm the type of person that is see how it goes. So as much as I'd love a 5-year plan with a brain tumor, it's not quite something that's been on my list. So I'm the type of person that we go, let's take it a project at a time and see how it goes and see how closer we get to these goals being achieved. But definitely have a look at your barriers and just think less is always my daily motto for everything. I mean, obviously think about things because you might get yourself in trouble, but we need to not stop overthinking. And, you know, we live on a floating rock. So isn't it so cool that we can all just come together and do all this stuff? It's fantastic. So act now, start right now. What are you waiting for?
Absolutely. Thank you. And moving on to Tommy, your last words. Any advice for young people who would like to turn their ideas into action, and also anything that you would like to share, your last words, and any interesting work that you're planning on doing in the coming few years?
To every young person listening, don't allow anybody despise your youth. Do what you have to do. You can do huge things, big things from small places. Start. Learn to volunteer, find somewhere that aligns with. That's how sometimes you discover what you're passionate about, what burns in your heart, what don't you like in society, what would you like to see changed. That is sometimes how you start to develop a burden that eventually becomes something that you're able to run with as an initiative. An initiative would usually require at some point structure, and that's what volunteering does for you. Helps you see what structure looks like in other organizations, and then you can use that in channeling your passion and your youthful energies into doing what you want to do. Research, ask questions, read about the sustainable development goals, immerse yourself in what is happening in your community, be an avid reader, being someone that just wants to effect change, not someone that's running after accolades or anything. The world will thank you for it. You will thank yourself for it. And like Molly said, live like it's your last day. Do what you have to do. You'll never know what one life that you're affecting or one life that you're talking. You never know what you're snatching that person from or what you're snatching that person's generation from. What do I want to do? Well, set up more structure, scale up on the road to 1 million girls. If I need to pivot, whatever that looks like, I'm just hoping that I'm able to do it in a better, more structured and more impactful way. God willing, in the coming year. Thank you so much.
Thank you so much, Tommy, for sharing your vision and your advice. And that sort of concludes the questions that we had. I would like to say a few words before we sort of finish our session. First thing is that every single one of you is a featured Changemaker from our platform, the Global Activist Network. So I encourage everyone who joined today and who will be watching our session at a later stage to go and read up on the full profile of our panelists who joined us today, and you'll of course find other change makers as well. So we're really proud of you, and we believe in the genuine work that you're doing, which is why we have selected you, and that is our objective. We want to go to people who are facing adversity, yet they don't stop. So, you really inspire us. So, we would like to find out from you all how we can help you further spotlight your work. So we're going to reach out to you, the featured change makers and everyone, to get feedback from you, and we'll try to incorporate that into our work. Please follow us on our social media handles, because that's how we amplify your voices, and we reach out to people who don't know about us, about the work, and who don't know about your work. Like it was amazing to have someone from Nigeria, someone from Gambia, someone from Wales. We are making this world a smaller place that way by connecting. One of the other things I will say, that Molly, you mentioned that you collaborated with Anvi. I think she might have joined our session today. Please self-nominate. If you know someone who's doing amazing work, nominate themselves. We can, go through their profiles and feature them. If you want to collaborate with each other, reach out to each other, follow, visit our website and do that. So, and that's pretty much it. We'll come back with more exciting plans in the new year. I'll finish by saying that I came across this really inspiring African proverb that says, "Each one teach one." And that's sort of the remit of my work. I always try to see if I can at least make a small change in one person's life. If that's done, then I move on to the second one. And I think that's something that we can take away in the New Year's. And you all are amazing. You all are change makers. So I don't have any advice to give you, but if you have great ideas, please do reach out to us. We're always open. And thank you so much for joining from all over the world and sharing your advice, your insights, your vision. Thank you so much, everyone.
Thank you, Lamona. Yeah, so does anyone have any questions? If you have any questions, I think there's some I don't know if you went through the chat, but there was one question from someone in, I think Laila Wang. If you want to mute,
Yes, I have noted. I think it will be better to I can put that question towards our panelists. She wanted to know how to go about launching a not-for-profit organization. I don't know if any of the panelists wanted to answer that.
Yeah.
If not, we can always reach out to her and give them some ideas.
Yeah, I think if you can also put like the links to your socials or your email addresses in the chat, that would also help in case like anyone wants to like reach out to you. Then, so I think that's better. So, Molly, Dauda, and Tommy would leave their email addresses or their links to their socials, LinkedIn or whichever social media platform you're easily like reachable. So, maybe Lila, I think your question requires a more detailed answer. I think so. I think it'll be better that way. But thank you so much, just like Lamona said. But before you go, I have two questions for you all, so you can take it in turns. So the first question is, what has been like your lowest moment doing this? I mean, sometimes I think it can take its toll. You're a change maker, you're an activist, you're really passionate about what you're doing. But as a human being, like sometimes, I mean, we all have our low moments. So what has been your low moment so far doing this amazing work? And also, I think Lamona mentioned, or I think when Tommy was talking, I think her last session, she mentioned something about recognition. So how important is recognition, like awards, all these things to the work that you do? Does it matter to you at all? Or is it something that you just kind of like, if it happens, it happens. If it doesn't, like you're still doing the amazing work. So two questions about the recognition and also your low moments. So any of you can take it or start.
I'll go first. I'll start with the recognition one. I've been really lucky to get multiple awards, including my British Citizen Medal, but nothing changes afterwards. And I think that's very key for people to remember. And when you get nominated for something, that's because you've already done the work. When you've won the award, it doesn't matter who's won the award, you've all done the work. And it's just the chance of the judges and the work. And of course, some fantastic programs have come out of it. I was named Wales's only Diana Award recipient for 2024, and some fantastic programs and connections are going to come from it. Award ceremonies are the best places to network. They are fantastic. So go, be there. But I wouldn't measure it on success at all. I know so many activists, change makers, organizations that don't have any awards, but I think do more valuable work. And I see how hard they work compared to some that do. And I know that that's opinion, but I'm not afraid to say it. And then low moments would definitely be for the periods and girls' rights work, being in a room and talking to people who are very high up, change makers / politicians, because of the roles that they're in their jobs, not as opposed to an activist who you just know it is like banging your head on a brick wall, unfortunately, and can come out with some very harmful phrases with underlying sexism. We know there's a massive issue now when it comes to gender rights. And people that are identifying and going further than being male or female, and how that strikes really difficultly in international law, with different countries having different laws, opinions, different rights. So that's been very, very difficult to tackle. But when politicians and people very high up come out with very harmful, offensive phrases, we know we've got a massive, massive issue. And we know that there are politicians that do that for pretty much anything that would make anyone a minority, unfortunately. And there are some very underserved communities because of very many of these harmful beliefs and phrases said that do come with consequences that they don't realize. And then in the brain tumor work, unfortunately, I make lots of friends who don't get to survive. And that's a massive drive for the work that I do. Many of them were massive change makers, massive activists, people that would have been here talking on webinars like these, but unfortunately didn't get to survive. And I see this happen way too often. So it's fighting the grief of that and trying to deal with that personally whilst challenging it as the whole internet sees it. Some of these people become massive in their following and their work. And then it's grieving a friend, along with watching the whole world do the same, of people that love them online. So that shows the power of social media, really. But that does drive the change, because at 22 years old, I shouldn't have lost more friends than are alive. It's not right. So it's trying to keep that in the forefront of my mind when going into this change and these really, really challenging conversations, looking at the statistics and remembering them and channeling their energy into that. Thank you.
Thank you. Tommy, do you want to go next?
Sure, thank you. I think that recognitions are cool, they're good. Sometimes they are validation for what you're doing. But with or without them, for me, I think that the work continues. Regardless, like, keep doing what you're doing. If they come, that's very good. If they do not come, then it's fine. Your impact speaks more for you than any of those recognitions. But I think that sometimes they're very good for the ego. They're good for motivation. They're good to encourage your team. They are good to encourage yourself also when you're in your low moments. But we must never base our worth, what we're doing, on recognitions or words, because life is fleeting. People also are fickle. The people that praise you today, tomorrow, they can vilify you. So there's none of that is constant. So but just keep being true to ourselves. Lowest moment, a few years ago, I went through a very personal, very challenging time, and it was unexpected. It was painful, it was long, it was drawn out. And it's almost made me stop everything. And it was one time when I felt like I would not be able to continue the things I was doing because it was so left field and unexpected. But trying times pass, challenges pass. I came out of that situation better, stronger, more positioned to even help people that have been in such a situation. And instead of dimming my light, which I thought it would, it has made me wiser, brighter, and more, in fact, more fired up to do more for the community that I serve and the communities that I serve, and to be a better person. So yes, it was painful, but I'm grateful to be here and I'm grateful for the opportunity. Once there's life, there is hope. So I'm grateful to have overcome that personal challenge and to still be here doing what I'm doing. Thank you.
Thank you so much. And Dauda, briefly.
Thank you so much. For me, when I start this organization, I wasn't thinking about recognition because I wanted to do something from my heart. I wanted to do something for my people. I want to bring change in my community. But then I wasn't aware of that I will have award from 25 under 25 global legacy changemakers or from global activist network to be recognized, not recognized. So I wasn't thinking about it, and I didn't know them before up to now that I was recognized. But whatever you're doing, just do it from your heart. Whatever you're doing, do it for humanity. Do it for your people. You know, the impact you bring in your community is one of the most important things. So whenever that, then you're also grateful to know that it shows to you that what you're doing, of what you're doing, people are aware of what you do. People appreciate doing. That's why they recognize. So, but then the thing is, do what you're doing from your heart for humanity and for your people, bring positive impact and change in your community. So for me, that's what I believe in. And also for this recognition, they are very important because when you are recognized, it gives you, it motivates you, it gives you more encouragement, it encourages you to keep doing what you're doing because already you realize that people are aware of what you're doing. So that motivates you. And also when you get when you are recognized and when you win award, that also inspire people that you are leading and other youth out there, oh, that person, X person has been recognized, X person has won award. I think I can also win award someday if I'm doing something that is impactful, that is bringing change in lives of people, So what I believe in, just do what you have to do from your heart for your people, and then the rest will come. Yeah, thank you.
Yeah, thank you so much. Lamona, over to you. You can wrap up now.
I think I sort of covered all the points, but just to reiterate once again, please follow us on our socials and please visit our website. Make a self-nomination, nominate someone else who you know are doing great work, and also join our membership, because anything that we do, any program, any initiative that we launch or we are planning to launch, will reach out to our membership for advice, for opportunities, everything. So we will share a recording of our today's session. These will be available on our YouTube channel. We are on Instagram, we are on LinkedIn, we are on Twitter, we are on Facebook. Also, we are on Spotify. So any sessions that we do, any spotlighting that we do of the change makers, of any experts, they always remain within our database so that people who couldn't join at the time can go to our social media handles and access them at a later stage. Today's session, today's recording will be on our channel very soon, and we'll share with you all. Please do keep supporting us by sharing your stories, your voices, and by amplifying each other's work. Thank you so much.
Thank you. Merry Christmas in advance, and then yeah, Happy New Year in advance. And yeah, we'll probably see you on our next session in the new year. Thank you, and have a good evening and a good weekend.